Assalamualaikum warahmatullahi wabarakatuh and good day to all of you. My name is Meisha Saiduddin and I'll be giving a summary of British social service today, including how they evolve, how they operate, and how social, economy, and demographic shift continue to influence them. Although this subject may seem wide, it actually touches on many aspects of daily life, including housing, social security, healthcare, and community assistance. I will therefore define everything into several sections in this presentation, beginning with the historical context, working my way up to the current system. The first thing is history, early development of social service. Before 15, there's no state welfare, support only from church, charity, and guild. Elizabethan Poor Law from 1558 to 1603 is parish responsible for the poor. In 19th century, the industrial misery turned into local health board and Public Health Act from 1848 until 1875 established national health apparatus and early reform, including housing, sanitation, factory, and mine regulation. Historically, the British state didn't provide any social service at all, so if people were poor, sick, or unemployed, they could only rely on church, charity, the feudal system, or craft guild. Major change only emerged in the era of Elizabeth I through the Poor Law. And here, the state began to take over social assistance from the church, especially at the parish level. In the 19th century, industrialization made the living condition miserable, like overcrowded housing, disease, pollution, and everything was chaotic. This forced several cities to establish a local health board. The Public Health Act from 1848 was the very beginning of the public health system, but it wasn't until 1875 that England truly had an effective nation structure. During this period, reform also began to areas of housing, sanitation, factory condition, and mining. So, even though it was not yet modern, the foundation began to take shape here. The foundation of modern welfare state. Social reformer pushed to change despite strong resistance. Liberal reform from 96 to 1914 about pension, national insurance, and labor protection. World War I and interwar crisis slowed progress but need increase. Beveridge report from 1942 about blueprint of the welfare state. In the early 90s, many social reformers pushed for major change, but they first had to fight vested interests in Parliament who basically didn't want to spend money. The big turning point came with the liberal reform from 96 until 1940. This is when old age pension, national insurance, and labor protection began to emerge. This eventually became the foundation of the modern welfare state. Unfortunately, World War I and the economic crisis of the 1920s until 1930s stalled this progress. The country was exhausted, money was running out, but the needs of the people were increasing. And later, the turning point also came with the Beveridge Report in 1942. This report outlined a complete blueprint of the welfare state and became the basic of major reform after war. Next, changing family and demographic structure. Changing in the family structure, decline in marriage is rise in remarriage and cohabitation. More single-person household is like 29% of all households. High divorce rate, also remarried have higher risk, increasing in one-parent families, and non-marital birth is like 39%. Delayed childbearing is equal to small family and more childless couple. In the United Kingdom, family structure has changed dramatically compared to past. Marriage rate continue to decline, and many choose cohabitation or living together without marriage. 1 in 3 households is now occupied by people who living alone, whether because they are unmarried, divorced, or widowed. In United Kingdom also has the highest divorce rate in Europe, and remarriages are more likely to end in divorce than first marriage. In addition, non-marital births, like usually from cohabiting couple or single mother, have increased like 39% of all births. People are also delaying having children. On average, women give birth at the age of 28. Many choose to have small family or even remain child-free. All of this has made family structure more diverse and no longer resemble the traditional British family that's often imagined. Demographic shift and impact. Aging population, 1 in 6 over 65 is like 70% over 75. Longer life expectancy for men is like 25 years old and woman is 80 years old. More elderly women, families still do most caregiving to elderly and disabled. Rising burden on families as need increase. Demographic change influence social security, health, and housing. In addition to change in family structure, demographic factors have also major influence. The United Kingdom is now experiencing an aging population. 1 in 6 residents is over 65 years old, and older women are the most numerous because of their highest life expectancy. Interestingly, even though the country has social service, most of the care for the elderly and disabled is still provided by family. This does save the country money, but the burden is getting heavier as the number of elderly people continue to increase. With conditions like this, people living alone, smaller family, and an aging population, the burden on social security, health service, and housing is increased. The government must adjust its policy and social service to keep up with this change. Next is Social Security. Structure and type of Social Security. Social Security is actually most expensive government program. It's like 30% public spending, funded by taxation plus national insurance contribution, operated by Department of Work and Pension, with type of benefit is first, contributory for worker paying NI, second, income related for low income or no income group, and the last one is non-contributory for disabled and family-based allowances. The key scheme is to income support, working family tax credit, house benefit, and child benefit. Social Security in the United Kingdom is the most expensive government program. It's about 30% of all state spending. The system is managed by the DYP and funded by tax and national insurance, which are paid by worker and company. The benefits are divided into 3 categories. First, contributor, for workers who pay NI. Second one is income-related benefit for those whose low incomes or no incomes at all. And third one is non-contributory that focus on specific needs such as disabled and care allowance. Example includes income support for low-income households, working family tax credit for low-income working family, housing benefit to help with rent costs, and child benefit which is paid to all mothers regardless of incomes. Challenge poverty and government reform. 27% of British people are income-related benefit. A quarter population live near the poverty line, included 4.5 million children. Costs rising due to aging population and persistent unemployment. Labour government reform goals is to reduce fraud and cut costs, targeting those most in need and encouraging self-reliance and employment. Criticism is also come like real cuts to housing benefit, income support, and disability allowance, and etc. Although this system helped many people, the number of recipients is huge. Like 27% of the population live on income-related benefit, and 1 in 4 people live close to the poverty line, including 4.5 million children. The costs borne by the state continue to rise due to aging population and unresolved unemployment issue. The government, especially during the labor era, tried to reform the system. The focus was on reducing fraud, cutting costs, and targeting assistance to the group most needed. But they also want people to be more independent, actively work, and not automatically rely on the state. This also been widely criticized as a real cuts to some benefit, such as housing benefit, income support, disability allowance, and unemployment support. The government said that social security costs are no longer sustainable, so they are encouraging self-provision to employment. Next is National Health Service, the origin and principle of National Health Service. National Health Service is established by Labour government in 1947, based on Beveridge Report recommendation, and replaced the private paid healthcare to free treatment for all. The goal is universal, comprehensive, and accessible health service, with the services such as hospital, GPs, dentists, nurses, midwife, ambulance, and blood transfusion. National Health Service is also financed entirely from taxation. The National Health Service was established in 1947 by the Labour Party, and its model followed the recommendation of the Beveridge Report. Essentially, they want to remove the financial barriers so that everyone could receive healthcare without having to worry about whether they could afford it or not. What used to be private, fee-based system was transformed into free treatment for all, and the services are comprehensive, from hospital, GPs, dentists to ambulance service and blood transfusion. All of this is funded purely by taxes, organization, service, and delivery. National Health Service is cost like 43.4 billion per year. 50% government spending, is a large employer in Western Europe, managed by Department of Health and devolved government. Primary care group control like 2/3 of National Health Service budget. GP system is average is 200 patient per doctor. National Health Service Direct is phone-based nurse advice line, mixed effectiveness. Specialist referral, National Health Service Trust Hospital like 370,000 bed. The National Health Service is very expensive. It's about 50% of total government spending. And it is the largest employer in Western Europe. Its management is now more decentralized, with the Department of Health and devoted body in Scotland, Wales, and Northern Ireland. The main service system is through GPs. On average, doctors have about 200 patients on their list. There also National Health Service Direct, a telephone service for advice from nurse, although reviews are mixed. If patients need further treatment, GPs will refer them to specialists at National Health Service Trust Hospital. These hospitals are funded through contract from primary care groups and have over 370,000 beds. Public perception, criticism, and reform. National Health Service got praised by their free access, rising health standard, and medical progress, but also got criticized by their inefficiency, bureaucracy, and regional disparity. Staff concerned about low pay, long hours, shortage of doctor and nurse. Long waiting list is equal to frustration. Government reform with more funding, reduced management costs, and reorganized admin. WHO ranking the United Kingdom 24th place of 191 in 2001. Private sector like BFI, private hospital, Bupa insurance, quarter patient pay privately, like 400% considered going private. The National Health Service has a unique position in the public eyes. On the one hand, many are proud of its free service and improvement public health, but gut criticism is also fierce. It's considered slow, overly bureaucratic, and the quality of service varies depending on the region. Many health workers also protest about low salary, long working hours, and a shortage of doctors and nurses. Long waiting lists also frustrate the citizen. The government, especially during the Labour era, attempted reform, increasing funding, cutting management costs, and reorganizing administration. Even so, many people say the results have not been significant. The WHO once ranked the United Kingdom 24th place of 191 countries, so it's actually not as bad as people think. Personal Social Service Overview and Target Group. Personal social service support for vulnerable groups like elderly, disabled, mentally ill, family, and children is provided by social workers, district visitor, and care staff, managed by local authorities with central government funding like 10 billion, aim for community-based care and support. Personal social service in United Kingdom focus heavily on helping vulnerable groups, from elderly, people with disability, people with mental disorder, to family and children. The service is carried out by trained personnel such as social worker and district visitor, and the measures are managed by a local government with the central funding. The main goal is to ensure that these individuals can remain in their community and not always have to enter institutional care. The challenge and pressure. Growing elderly population is also means rising demand, shortage of residential and nursing home place, Serious staffing problem like low pay and lack of training, and also increasing number of disadvantaged people needing support. The main problem is that the system is under tremendous pressure. The elderly population is growing, but there is not enough place in residential and nursing home. Not to mention, the labor shortage, salary are low, training is inadequate, and turnover is high. Added to this is the fact that the number of people who need assistance is also rising. So the system is really being pulled in all directions. Care in the community and child protection. Care in the community is meant to encourage home-based care, support from family caring for elderly and disabled. The problem is homelessness, inadequate housing, and inconsistent care. Service for learning disabilities, fostering and adoption. Abuse case in children's home raised constantly. The Care in the Community program is actually a great idea. Its goal is to help families so they can care for the elderly people with disability at home, allowing them to be more independent and not always have to go to an institution. But there are still many problems with this implementation. There are patients with mental illness or mild disability who end up homeless or living in an unsuitable place. They also take care of children in care home, foster care, and adoption. However, several cases of abuse have emerged, causing the public to become skeptical and demand major improvement. The next one is housing. House structure in Britain. About 68% owner-occupied, 11% private, and 21% social housing. The social housing managed by the local authority and housing association. Decline in public housing stock over time. Right to buy policy increased ownership but reduced social housing. Housing in the United Kingdom is divided into three categories. The majority of people own their own home, a small number rent privately, and the rest live in social housing. There used to be a lot of social housing, but it declined dramatically due to conservative government's right to buy policy. Many people bought cheap homes from the government, but the stock of social housing was depleted. House problem and inequality. The shortage of affordable housing, rising homelessness, especially in a city like London. Private sector not building enough low-cost home. Regional price disparities like Southeast is more expensive. Poor quality housing in some area is modernization ongoing. The big problem is that affordable housing is not enough. This causes homelessness to rise, especially in the big city like London. The private sector does not build low-cost house fast enough, and housing prices vary greatly depending on the area. The Southeast is the most expensive one. Many old houses are also poor quality, so the government is trying to modernize a house estate. Attitude toward social service, public opinion and expectation. The public strongly value free, well-funded service, and many support higher taxes to improve national health service and social housing. But the concern is over privatization and management quality. The skepticism toward public-private partnership and support better pay, more staff, and more investment. The British public opinion is very clear. They love free and well-funded public service, such as National Health Service, and social housing. Many even agree that taxes should be raised to improve service, but they also fear that privatization will lead to a decline in quality. PPPs or partnership with the private sector are also often viewed negatively. What citizens want is a better service, more staff, and more human wage for health worker and social worker. And in conclusion, social service in Britain have expanded from modest, neighborhood-based charitable endeavor to vast and intricate system encompassing housing, healthcare, welfare, and individual assistance. Despite the obstacles like growing expenses, shifting family dynamics, and aging population, the system continued to play a vital role in United Kingdom public's life. I appreciate you listening and I welcome in any question. So, wassalamualaikum warahmatullahi wabarakatuh.